The COVID-19 pandemic has affected millions of people worldwide, and it has brought about a lot of changes in our daily lives. However, there is one group of people who are particularly vulnerable to this virus: asthma patients. Asthma is a chronic respiratory disease that causes inflammation of the airways and makes breathing difficult. Asthma patients are at a higher risk of developing severe symptoms if they contract COVID-19 because it is also a respiratory illness that affects the lungs, and asthma patients already have compromised lung function. The COVID-19 pandemic has brought about a lot of fear and uncertainty, especially for asthma patients. They are worried about their health and the risk of contracting the virus. One of the most important things that we can do to protect asthma patients from COVID-19 is to follow the guidelines set by health authorities. This includes wearing masks, practicing social distancing, and washing our hands regularly. These measures may seem simple, but they are incredibly effective in preventing the spread of the virus. Another way to protect asthma patients from COVID-19 is to ensure that they have access to their medication. Asthma patients rely on medication to manage their symptoms and prevent asthma attacks. Furthermore, we must also ensure that asthma patients have access to healthcare. COVID-19 has put a strain on healthcare systems worldwide, and it is essential that asthma patients can access the care they need. This includes regular checkups with their healthcare provider and access to emergency care if needed. In addition to these measures, we must also raise awareness about the risks of COVID-19 in asthma patients. Many people are unaware of the increased risk that asthma patients face when it comes to COVID-19. By raising awareness, we can ensure that people take the necessary precautions to protect asthma patients from the virus. In conclusion, COVID-19 has brought about a lot of fear and uncertainty, especially for asthma patients. This includes following the guidelines set by health authorities, ensuring that asthma patients have access to their medical needs, and raising awareness about the risks of COVID-19 in asthma patients.